right, good morning, everybody. Dr. Rafich here, Vet Triage. Thanks for everybody watching the playback and sharing and subscribing. We're going to talk about veterinary dermatology today, or rather, what you can expect as a pet owner to when you visit a dermatologist. So, derm conditions in general is probably it's definitely top three most common animal issues that we see. Probably number one is gastrointestinal, and maybe number two is derm, skin related diseases. So, um, the the challenge with veterinary dermatology is that a lot of veterinarians, if they know they can't do a surgery, let's say like fix a broken bone, they send it to a surgeon. But something like allergies, for example, or other skin conditions, veterinarians are sometimes, maybe overly confident um, on it, or they are really proficient in derm cases, and so they tend to like try and manage the stuff on their own, and then they don't really know when to refer. So I'll just go over kind of the basics with this, and whatever pet owner is listening to this, hopefully it helps you out, especially if you have a dog or a cat with skin issues, which I imagine anybody watching this now or later will probably, chances are someone has been in that situation. So when you go to a dermatologist, the whole goal there is to figure out what's going on with your pet's skin. Um, this skin is the largest organ in the body. It provides um, multiple functionalities. It's a very complex organ, even though we don't think about it that way. And number one most common skin issue in animals is going to be allergies, whether it's food or environmental. I have a video on my channel about this, talking about allergies. Feel free to watch or listen to that one. I can't remember if it's a podcast or not, but check that out. Anyway, allergies is the most common, and there's other things like skin infections, immune diseases, cancers, fungal infections, etc. So, um, and there are conditions that are actually internal problems that manifest themselves with a skin issue. So skin can be quite complex, even though we always think about like allergies or mange or something like that as being the main conditions, but it can be much more complex than that. So the dermatologist will have good mindset about um, a good mindset about whether or not the your family veterinarian is attacking this appropriately, whether or not the diagnostics that they performed or did not perform, are appropriate, medications, all that stuff. So that's what the dermatologist job is going to be. Now, the other difficult thing, sorry guys, about dermatology is that there aren't that many. Um, there are a large number, but they're spread out across the U.S. So you don't always have the luxury of accessing one easily. And of course, the other problem is that obviously you have to pay for the dermatologist, which is definitely worth it. It'll be more expensive than your regular vet. And sometimes you've been seeing a regular vet for this skin condition for months, years, and so you've already spent like hundreds or thousands of dollars at this point, and now you're going to, you feel like you're starting over with a dermatologist. So the biggest challenge that I see with a dermatology referral is that the referral happens too late. But at the same time, for general practitioners out there who are listening to this, not every skin condition needs a dermatologist. There are plenty of skin conditions that a general practitioner can handle. There are plenty of general practitioners who are very good at even complex skin conditions. So, it's a tough one. I imagine there's a lot of frustration on the side of dermatologists, pet owners, and general practice veterinarians regarding this. But anyway, when you go to the dermatologist, they're going to have an initial consult with you based on reviewing your medical history from before, tell you what they think might be going on, and how to confirm that, rule that out, what tests need to be done, and then go from there. Sometimes it's as simple as, yeah, we need to create an allergy vaccine for your pet because your pet has allergies. It's very clear, and your veterinary diagnosed that. We agree with that diagnosis. Now you need a level of specialty care that they can't provide, like immunotherapy, which is vaccinations created to fight to help the immune system fight something. And so with allergies, that is an immune system problem, that those vaccines are a main course of therapy for dogs that have allergies. But anyway, so maybe your veterinary did everything right and they know what's going on, and the dermatologist's involvement is to confirm that, but also to continue with therapy that's beyond the scope of what a general practitioner can do. Or your GP, general practitioner was just wrong from the beginning, and you guys have been barking up the wrong tree, so to speak. And they need to be like, look, yeah, they've been treating you for allergies for years. Allergies not the top of my list based on the history, medical history, all that stuff, and how your pet looks today. We need to do A, B, and C tests to figure it out more. Occasionally, you have dermatologists that have access to internal medicine type workups, whether it be through a specialist or they're used to handling more complex cases, but things like blood work, ultrasound, these are things that dermatology may or may not have access to. So you may be visiting multiple specialists depending on your case situation. And the final thing is wait time. The specialists these days, especially, are backed up for weeks or months. Skin disease is not an emergency for the most part, unless you're talking about like a quality of life concern, where you're thinking about euthanizing the pet because the skin is so bad, or you're dealing with a dog that has, or an animal that has severe skin issues from like being in a building that was on fire. Those can be emergencies. But again, even in that situation, an emergency doctor would deal with that, not necessarily derm. So really, with derm, they're not considered emergencies, even though you're watching your pet scratch and lick and bite every single day, constantly. So there's the key thing here really is if your general practitioner is comfortable, confident, great. If they are not, or they're hitting a wall, then they need to refer. And referring earlier is better for the patient and for the relationship between dermatology and the general practitioner than a late referral. So, and then there's some tests that dermatologists will perform that are too advanced or too annoying for a general practitioner. For example, one way of testing for allergies is a skin test where you inject the pet is sedated, the entire one side of the body is shaved, and they inject small blebs of antigen, which is the protein that foreign material contains that binds with or triggers the immune system to recognize it as foreign, and the immune system attacks that antigen. So if you inject an antigen that releases histamine in the body, because of how the antigen is interacting with specific cells in the body, it'll cause an allergic reaction locally on that pet, like a small, like a mosquito bite. And so then the dermatologist will determine whether or not that's sufficient enough to say, okay, that pet has an allergic reaction to whatever, pollen or something, or chicken or whatever. Sorry, not chicken. These are environmental tests. But the point is, they do like 20 or 30 injections, each different antigen, and that's an annoying test to do. And so, and it's very subjective and whatever. And I don't know how many general practitioners are dabbling in that kind of test, but my point is that dermatologists will do these tests all the time, and so they probably prefer doing those tests anyway. And that was it. Some tests are only done by a dermatologist. All right. Well, I think that's probably it for today, guys. It's August 5th, 7:52 a.m. Pacific time. And I will try to be on again tomorrow, August 6th. Look forward to it. I may or may not continue this specialty conversation. We'll see. Maybe I'll switch gears. But thanks, everybody, again, who's watching and supporting the channel. And we'll see you in the next one. Take care.